Welcome to the PAH Today National Broadcast Series. My name is Dr. Lana Melendres-Groves, and I'm the Medical Director for the Pulmonary Hypertension Program at the University of New Mexico. In today's presentation, we're going to be talking about choosing a healthier PAH lifestyle. First, this presentation is sponsored by and made on behalf of United Therapeutics. Healthcare professionals are compensated by UT. The information presented here is for educational purposes only and is not intended as professional medical advice. Always discuss any questions you may have with your healthcare provider. Patient experiences relayed during this program may not represent the experiences of all patients. All right, before we get into the meat of this program, I really did want to highlight why this topic is so important. I realize that this disease can at times feel overwhelming, and things that I'm asking my patients to do and keep track of can also feel out of their control. Today is about putting it back into your control, and that's with very simple choices that you make on a daily basis, and how these daily lifestyle choices may make a big impact. For instance, did you know that making healthy lifestyle choices may actually improve the way you feel that day? Like experiencing less shortness of breath, or you may find that you're not having the swelling in your ankles and legs that you once had. Overall, this may actually be decreasing the extra strain that's on your heart. And when we look at something like your 6-minute walk test, we may see that you're now able to walk further. In today's presentation, what we're looking to do is break it down into 3 segments. The first is, why does diet matter? Next, movement makes a difference. And then my friend and colleague, Chris Eagan, will be joining to discuss a little bit about both of those topics and move into overall wellness. So, why does diet matter? Don't get me wrong, I know that a lot of people out there think of diet as one of those 4-letter words that you don't want to hear about. But I think when we start to really break things down to understandable and manageable aspects, that then you can actually impact the way you feel and not be scared of what that means to modify your diet. We have to start with fluid retention. That's always what we seem to talk about in PAH, because that's the area that can be shifting on a daily basis. Now, in medical terminology, we may be just saying edema. And really all this means is extra buildup of fluid within your cells and tissues of your body. What does that mean to you? That may mean that you feel like a bloating in your abdomen or swollen hands and fingers. Or you may notice that your ankles are more puffy, or that there's a ring around your ankle from your sock line. All of those things are indicators that you may be, and your body may be, retaining extra fluid. I think in order to understand how the body retains that fluid, we have to talk a little bit about the science behind it, and behind the sodium and fluid intake that you do on a daily basis. So many of you may already know that the body is made up mostly of water. This is a nice little depiction of a cell in your body and how the water molecules are both inside that cell as well as outside that cell. Well, now we're going to take it a little bit further. We've now added the green box, which is a representative of sodium. And as you can see now in this cell, there's both those sodium boxes as well as the little circles of blue, which represent the water molecule. They try to balance each other out, not only within the cell, but outside the cell as well. The more sodium that is inside the cell, the more fluid that's brought in to follow it and balance it. The same occurs when there's more sodium outside of the cell. This represents what you actually are taking in more on a daily basis, and how that fluid or water molecules will be shifting based off where the sodium is. So what does that actually mean in terms of how you feel or what it's doing to your body? Well, when you eat a diet that's higher in sodium, it can cause the body to retain more water to balance out that higher sodium content, which results in a higher plasma level as well as higher blood volumes. Those higher blood volumes can actually cause your blood pressure to increase. Well, this not only affects patients that I take care of with PAH, but it actually affects both sides of the heart, both that left side of the heart as well as the right side of the heart. Today, we're really going to focus on how and why it matters in terms of PAH. In some of our other episodes, we've talked about how PAH is really a disease and a dysfunction of the blood vessels that lead from the right side of the heart out into the lungs. And because of those changes within the blood vessels, it causes the right side of the heart, the right ventricle, to have to work harder to push the blood through those blood vessels. Well, when we start to have increasing amount of blood volume because of increased sodium or fluid intake, we find that an already overworked heart is now having to do even more because there's more volume of blood to pump. So by limiting your sodium or your fluid intake at times, you may be able to reduce the strain on the right side of the heart. All right, so now I want to get into a little bit of the nitty-gritty because I've been saying sodium throughout this entire time, but we never really talk about that in daily life. We often just talk about it as salt. Well, there's actually a difference. Both salt and sodium help control the balance of fluid in the body and can cause us to retain more water. But the difference is really that salt is what we add to our foods. So it is a chemical compound made up of both sodium as well as chloride, where sodium is what's found in our foods, especially in processed food containing preservatives. Now, the tricky part is that often it's not as straightforward as looking for something that says sodium, because in nutrition labels it may be called salt, or baking soda, or sodium nitrate, and so on and so forth. So by understanding that there are different ways of talking about sodium and salt, it will help you understand what is best for you and how you can make that the best choices for yourself. So how much sodium is right for me, or for you for that matter? Well, this is where always talking with your healthcare provider is essential, because you may have very specific recommendations for yourself. I think looking at it in a very broad way, we know that recommending the American Heart Association guidelines would be appropriate for most adults, and that recommends that you should not take in more than 1,500 milligrams per day for most adults. Again, talk to your healthcare provider about what's right for you. But when we talk about milligrams, again, that's not something that necessarily is, our daily jargon. So instead, we've tried to put it into how you look at it in terms of salt. So for instance, in the blue boxes, if you had 1/4 of a teaspoon of salt, that equates to 575 milligrams of sodium. As you increase, you can see that by the time you're putting in 1 teaspoon of salt, you actually have now 2,300 milligrams of sodium, much more than what would be the daily recommendation. There's also other hidden meanings to how things are stated, especially on the labeling and nutritional facts. For instance, in food labeling, it may be worded as sodium-free, or very low sodium, or healthy, all of which seem to be really great things if you're trying to follow a healthy, low sodium diet. But in reality, that really means very different things. So a sodium-free labeling would indicate less than 5 milligrams of sodium per serving, where being healthy indicates there may just be less than 360 milligrams of sodium per serving. So it's really important that you continue to look, you continue to educate yourself, and you continue to understand that very different words do actually mean different things, even if they may seem to be good. So we've talked a lot about salt and sodium, but I also want to talk a little bit about fluid, because as we spoke earlier, fluid follows sodium. So by monitoring your fluid intake, you can really help to minimize the extra shifts of fluid that your body experiences. Ways that you may be able to do that are actually measuring the amount of fluid that you take in. And no, we may not get a measuring cup out, but if you have a bottle that you use every day and you drink that full bottle, you know how much that is. Maybe that's a liter, maybe it's, the 16-ounce cans, but then track it. Keep a journal or keep it on an app so that you know what it is you tend to take in, and try to keep that about the same most days. One of the things that my colleague does is she actually does freeze a bottle of water and brings that to work every day. Not only does it keep the water cold, but it keeps her from just guzzling the entire thing all at one time. And slowly she takes the amount of fluid in that she needs throughout the day. We can do the same types of things to monitor sodium intake, tracking it, reading those food labels, understanding which foods you like and tend to eat most frequently and how much sodium they have in them. Also, really working to try and avoid eating out as best you can. And I know this may be the hardest, especially in this day and age where we're rushing from place to place. But when we eat out, they often add much more salt to the foods. There are things you can do if you're eating in a restaurant, which is to indicate to your server that you're following a low salt diet and to please not add extra salt to your foods. You can also talk with a dietitian who may be able to help you understand even better ways of finding low sodium foods that you'll actually really enjoy. All right, well, that takes us now into our next section on movement makes a difference. So I guess the question really is, should you get moving? And this is a question I get asked almost daily in my clinic from my patients, because there's always concern that moving may actually make you worse. And that is the absolute opposite of the truth. We want our patients to move. We want them to be able to increase their exercise capacity. Exercise may even help with decreasing the swelling in your ankles and legs and affect your fluid retention. So it increases circulation, and toned muscles use oxygen more efficiently than soft muscles. But it's also important to know that all exercises may not be appropriate for you. So talking with your healthcare provider and starting an exercise program is essential. Movement may also improve other symptoms such as shortness of breath, chest pain, or pressure. Sometimes it can really improve people's fatigue, even though that seems counterintuitive. The PAH treatment guidelines do recommend a supervised exercise program be considered for appropriate PAH patients under medical care. So that brings us to this term called cardiopulmonary rehabilitation. Sometimes your doctor may refer to it as cardiac rehab, pulmonary rehab, or cardiopulmonary rehab. So many terms, all just to describe a medically supervised exercise and education program that is available for many people with PAH. And what's so amazing about it is it can often be tailored to your individual needs. How might this help? Well, cardiac rehab may help with improving your overall quality of life, increasing your exercise capacity, and just helping you feel better day to day. Make sure you ask your healthcare provider if cardiopulmonary rehabilitation might be a good option for you. So what actually happens when someone with PAH does not exercise? Well, the first thing I want to say is that this isn't just for PAH patients. This is for all humans. When we don't exercise, we actually lose muscle function and we lose the ability to use oxygen as efficiently. We often feel more fatigued. Well, this couldn't be even more true for our PAH patients, because patients with PAH are already feeling fatigued and short of breath. But by not exercising, they're losing that conditioning that may help them overall feel better day to day and do better long term, because this can cause increasing symptoms like fatigue, shortness of breath, and difficulties performing your daily activities. So what are some tips to safely add exercise to your daily life? Well, the first and always most important is talking to your healthcare provider before you begin, because there may be some exercises that aren't appropriate for a patient with PAH. It's also important when starting an exercise program and when exercising that you don't do it alone. It's always good to have a workout buddy or a coach, not only because of the safety reasons, but also because having somebody there with you holds you accountable. Make sure that you're always paying attention to how you're breathing and don't hold your breath. And then listen to your body. If you are feeling short of breath or dizzy, or you feel as though you should stop or slow down, You should. Our bodies are super clever, and they let us know when we should be doing something differently. I also want to bring up something that often is overlooked, and I think is really important to just an overall mind and body improvement. While improving your PAH symptoms with exercise is tremendous, we also know that it can help to improve mood and combat depression. And in chronic diseases like diabetes, or for us in PAH, we want to make sure to reduce that risk of anxiety and depression and mood instability. And exercise is a really good way to try and do that. Well, I'm really excited to have Christina Eagan joining me today, who's my colleague over in Florida, and get her insights into how she talks to her patients about sodium intake, fluid intake, a little bit about exercise and physical activity, as well as emotional wellness. So, Christina, would you please introduce yourself for us?
Absolutely. Thank you. My name is Christina Eagan. I'm a doctorate level nurse practitioner at the University of Florida. I tell my patients to call me Dr. Chris or Chris. My role is somewhat hybrid in that I am the nurse practitioner for the pulmonary hypertension clinic, and I also do research studies in pulmonary arterial hypertension and pulmonary hypertension. And I'm very excited to be here today with you.
Yeah, well, wonderful to have you. And I just really want to get an idea of, how you bring these topics up with your patients. What do you tell them? And how do they take it when you talk to them about it?
Sure, absolutely. Yeah, these things are really important to talk with our patients about for a couple of different reasons. I talk to them about salt and fluid limitations, physical activity, and emotional wellness, because those are things that they can actually do something about. Mm-hmm. Many times there's a sense of loss of control when you're diagnosed with a disease, and giving them the power, the tools to do things that they can actually control to help themselves feel better is really, really important to me. I found that they're very receptive to it. I explain all of the whys that we do things, why we're asking them to do these things. And once they understand why, and they understand that they have some control and some power in their situation, they're more likely to want to do those things.
And I love that, because for me, I do think so often, when we feel that there's a lack of control, we become sort of frozen and we don't do anything. And so to allow someone, to then move forward because of the education we can give them, that's amazing. I guess, how do you notice when, patients have been following those good lifestyle choices? How does it affect them and their disease?
Yeah, it's really interesting because I can tell when a patient has been following the guidelines because they have less ankle swelling when I do their physical exam. Their 6-minute walk distance is improved. They tell me they feel better. So it's really, really rewarding to have a patient who we just want to help so much go from not being able to do all the things in their life that they want to do to being able to do those things because you gave them the information, you gave them the tools, you gave them the power to change their situation. And that is so rewarding to me.
And, I think that you bring up such wonderful points with that, especially because when your patients are able to follow some of those choices and start to feel better, we obviously also, as their provider and their cheerleader often, we feel so good. But I guess when we look at the flip side of it, maybe there are some choices that weren't ideal in terms of their PAH diagnosis, but honestly, I know I don't always make every choice every day that's best for me. And so how do you address that? Because I always am so worried that I don't want a patient to not call me or to feel that they failed in some way because maybe one of the choices that they made that day, wasn't in their best interest, but they really missed a food that they love to eat. So how do you deal with that?
Of course. We understand these things are really, really hard to adhere to. And patients are occasionally going to have a day where they cheat, where they're feeling particularly down. They want to eat something comforting, and they do. What I tell my patients is to please just get in touch with us if something like that happens, so that we can come up with a plan for them and figure out what we're going to do.
And that's one of the things that I find. I think that as long as we're always looking forward, always planning, always giving them the tools to be able to say, okay, if something happens, we're here to support you, that we can always get back on track. And so that for me is really key to making sure that my patients and I have that relationship that allows us to move forward. I guess I want to shift gears a little bit, because we've talked a lot today about sort of our salt and fluid and some of those. But one of the areas that I really harp on with my patient population is getting into cardiopulmonary rehab. Do you find that that's something that's important for you and for your patient population?
Yes, it is very, very important. And we recommend cardio rehab to all of our patients. It can be extremely beneficial because many of them don't know how to begin an exercise program or what they should even be doing now that they have a diagnosis of pulmonary hypertension. So I recommend that they all go to cardio rehab so that they can learn the exercises, the tools, the things that they can do later on their own at home so that they can keep themselves as healthy as possible. And most of them are really receptive.
So this has been fantastic, and it's really lovely to hear how you talk to your patients, and they're clearly very lucky to have you as their provider. And I'm really lucky because I know you're going to take us into the next section on wellness. So I think we'll get to it.
Thank you so much for that excellent conversation. We're going to transition into talking about some tips and tricks for overall wellness. Building healthy habits can make living with pulmonary arterial hypertension much easier. In addition to eating well and exercising, your overall wellness includes getting proper rest from good sleep hygiene and a regular routine with quality sleep. Some tips for helping you get a good night's sleep are consistency. Coming up with a routine that works for you and sticking to it is very helpful because it helps your body know what to expect and when to go to sleep. Comfort is also crucial, especially if you're wearing oxygen at night. Finding a good mask, finding a machine that's not loud so it doesn't wake you up. Those are things that you can do as well to help you get good sleep. Things that you can avoid include caffeine, heavy meals, too much fluid so you don't have to go to the bathroom in the middle of the night, alcohol, and nicotine, which can also interfere with sleep. Keeping up with your emotional well-being is just as important as your physical health. So don't forget to reach out to your support network, your caregivers, your loved ones, your PAH team. We are all here to support you, so don't hesitate to reach out to us. Shoot us an email, give us a call anytime. It's also a good idea to get into a regular contact routine, even when you're feeling well. So that way it becomes second nature when you're not feeling well. Just reach out and get in touch with us. And on that note, I'm going to kick it back to Dr. Melendres-Groves.
Well, once again, I want to thank Chris for the conversation, but also for taking us through the last section. And that really brings us here toward the end of our program today. I do want to bring up some of the support resources that you can take advantage of. There are online resources available that have helpful tools for tracking your mood and your symptoms. There are also many associations for PAH that offer emotional support from others who understand what it's like to live with PAH, and we've listed a few of them here today. In order to summarize, we talked a lot about choices today. And there were key areas that I hope you can take away and implement into your daily lives. And that's including limiting your fluid and sodium intake, which can help to avoid increases in your blood volume and reduce the strain on your heart, as well as improving swelling or edema in the legs and ankles. Also, regular exercise may help to increase your 6-minute walk distance and reduce your fatigue and overall improve your PAH symptoms. But remember, proper rest and emotional support may be just as important as all of these other things we've talked about. And improving your overall well-being by both a physical and mental improvement and focus on what your specific needs are, reducing those feelings of depression and anxiety. So remember, the choices you make matter, Ask your healthcare provider about a lifestyle plan that can help you feel your best.